Hi, everybody. Today we are going to look at a few muscles of the cat. Again, unfortunately, we won't get the chance to look at the actual cat dissection in class. However, hopefully this will give you some ideas of what these muscles would look like if you were actually carrying the dissection process. I'm going to skip the first few slides of your PowerPoints, again, because these are focused on an in-person cat dissection, so you guys may just basically skip those slides. Now we're gonna start by looking at the chest muscles. So these are the muscles, these are the superficial muscles that cover the thorax region. There are total of 5 muscles located here, and you guys can kind of see the separation lines visible right here. So you have one muscle here, one here, one here, and one here. So starting with the shoulder muscle, that's called the clavodeltoid muscle. In human, it's only one muscle, but in cats, actually break down to 3 separate muscles. So the one that is the deltoid portion that runs over the shoulder is called the clavodeltoid. The next muscle in line is pectoantebrachialis. So it starts from the sternum and it works its way toward the brachia or arm. The next muscle in line is your pectoralis major, followed by pectoralis minor. And the last muscle that you have is this one right here called the xiphyohumerales. This muscle is specific to cats, we won't have it. And again, if you look at the name, you can kind of distinguish xiphoid process of the sternum and humerus as in your humerus, the bone. 4 points of attachment for these muscles. So if you're looking at them in an order, again, kind of looking at those white lines that are separating the muscles, we have clavodeltoid, pectoantebrachialis, pectoralis major, pectoralis minor, and xiphy or xiphyohumerales. If you go to the arm region, the 2 main muscles we have discussed that are more superficial are your biceps brachii and triceps brachii. So right here, you can depict the biceps brachii, and if I go underneath that, that would be your brachialis muscle. So superficial one is biceps brachii, and like what we saw in an actual muscle models, or you will see later on, underneath one would be brachialis. Triceps muscle has 3 pronounced head, and that we will be able to distinguish on our cat. So in this position, your cat is in a prone position, so you can see basically the lateral view of the arm. So the muscle that is on the lateral view is referred to as the triceps brachii lateral head. The one that is right underneath the arm, that's the triceps long head. And if I position my cat in a supine position, the muscles that would be right here underneath the arm, but on the medial view of the arm, that would be medial head of the triceps brachii. So if I ask you guys to name these muscles, always remember, guys, you have you start with the triceps brachii, and then you identify it either as the long head, lateral head, or medial head. If we look at the forearm region, we have muscles that are very similar to humans. So in the sense that you have muscles that are flexors that are essential in terms of flexing your wrist. And you have muscles that are identified as extensors on the opposite side. And these muscles are essential in terms of, again, the process of extension or the action of extension. So how do we identify these muscles? So if you're looking at the flexor side of the muscles, we will have a large or a very broad, thin muscle with a very fine, shiny fascia or tendon. And this one is the palmaris longus muscle that sits right in the middle. Now again, notice if in this picture you have one that is right here, this broad muscle, which is the same thing as here, again with your palmaris longus. Now your cat head is right here. So if I'm moving this way closer to the head of the cat, I'm moving on the radius side. And if I move over away from the cat's head, that's the opposite side, basically your pinky. So that's the ulnar side. So one on either side of your palmaris longus. The one immediately toward the head, away from the palmaris longus, that would be identified as your flexor carpi radialis, because again, it's on the radius side. And the one on the opposite side, again, moving away from the head, would be your flexor carpi ulnaris. Now, if you twist the arm, the forearm slightly, right next to your, in this view, you will see a triangular muscle. That's your pronator teres. And the one right next to it would be your brachioradialis. So these two muscles are your brachioradialis and pronator teres. So when you look at the opposite side of the arm, what you will see, and I'm going to show you all of them at once because I think it makes it a little bit easier. You guys are welcome to look at them by themselves. But mark your brachioradialis as your marker, right? So this is your brachioradialis. Next to your brachioradialis, you have your extensor carpi radialis longus. Next to that, you have the extensor carpi radialis brevis, which basically means you have the long head and the short head of the extensor carpi radialis muscle. So brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis. And then you go into the extensor digitorum. And then extensor digitorum ends farthest away from the head, which is right here again. That would be your ulnar side. So that would be your extensor carpi ulnaris. Now, if you turn the arm around right next to this muscle on the opposite side of the arm, you will have your flexor carpi ulnaris. If you turn the cat around this way, right next to brachioradialis, you will have your pronator teres, followed by your flexor carpi radialis, followed by your palmaris longus, and again at the other end you will see your flexor carpi ulnaris. So mark brachioradialis as your marker. It's an easiest way, going on when your cat is in a prone position on the extensor side. And if you are on a supine position, then brachioradialis goes to pronator teres, which I showed you earlier in the picture. Then pronator goes to flexor carpi radialis. See how this is the broad muscle right here? So that would be your that would be your palmaris longus. And then if I continue to turn around the arm, right next to this muscle, you will have your flexor carpi ulnaris. And yes, it does take practice. I will strongly recommend for you guys to take a look at the muscles of the forearm in the models. And then when you feel comfortable with those, then move in and come back and review the cat muscles. Here's basically what I was telling you earlier. See your brachioradialis, the triangular muscle, that's pronator teres. Next to it would be your flexor carpi radialis. The broad muscle is your palmaris longus. And again, if I was showing you another muscle farther that way, that would be your flexor carpi ulnaris. Now, to secure the tendons of the forearm, you have another fascia that wraps right around the wrist. If it's on the flexor side, it's referred to as a flexor retinaculum. And if it's on the extensor side, it's called extensor retinaculum. Looking at the back of the cat, the same position, we have our trapezius muscle. We do have the same muscle in cat. However, trapezius in cat is divided to 3 parts. The region that is around the neck region is associated with the clavicle, so it's identified as clavotrapezius. The one that runs over your shoulder is associated with the acromion process, so it's called the acromiotrapezius. And the third one runs down the spine or connected to the vertebral column, so it's referred to as the spinotrapezius. Now, I'm going to move forward and show you these pictures. So in this picture, what I've done is I want to look at the deep muscles that are found within the shoulder joint or your shoulder. So what I've done is I have cut through the acromiotrapezius, which is this one right here. So I have cut through this so to see the muscles that covers the surface of the scapula. So remember the scapula had a spine, which is right here, and you can kind of see that white line right here. So the muscles that is located on top of the spine is called supraspinatus. And if you're looking at the muscle right below the spine, so see this is your spine right here, the muscle below the spine would be infraspinatus. So supraspinatus, infraspinatus. Now, if you look inside the shoulder, so in this side, this is basically the posterior aspect of the scapula. So if I look inside of that, underneath this, you will have a muscle called subscapularis. If you recall terminology from your skeletal system, the anterior aspect of the scapula, which lacks the spine, was referred to as subscapular fossa. So the surface of the subscapular fossa is basically covered with the muscle called subscapularis. Here's a different view. So they're showing you from the anterior. They're showing you the anterior aspect of the scapula, and that would be your subscapularis. Now, again, in this scenario, basically what we've done is we remove some part of the clavotrapezius, which was the superficial muscle, and most of the acromiotrapezius. So otherwise, this muscle, acromiotrapezius, would be the most superficial muscle. So right here, and what you see is that's the border of the scapula right here. This line that you see right here, that's the spine of the scapula. So this would be your supraspinatus. This is your infraspinatus. And all the way at the bottom of this is referred to as the teres major. You do have teres minor as well, but it's not one of the muscles you guys need to know. Now, this is what they're showing you right now is the back of the cat. So kind of helping you orient yourself because it might seem very unfamiliar. Here is the cat's head. Here are the two ears. So this is the back of the head. Right here is your clavotrapezius, right? And what you see basically reflected back here is your acromiotrapezius. So this surface right here would be your supraspinatus, and here's the spine of your scapula, this line right here. So what we have done in this picture is you have grabbed the cat's hands or arms and pushed them underneath the body. So it's kind of like you're tucking the arm underneath the body. That causes these muscle right here that extends from the vertebral column right here toward the scapula to pop out. So these muscles you see right here would basically be the muscles that connect the scapula to the vertebral column. These are called rhomboids as a whole. There is rhomboids major and rhomboids minor. However, again, for this level, I don't expect you guys to distinguish the two. Looking at the side of your cat, you will have the same muscle we have in human. So this is this big muscle that starts from your lower back and goes under the armpit. So what you see here, which was previously labeled on one of the slides I passed, this is your latissimus dorsi muscle. Deep to that, on the sides of the body, we will have your serratus anterior muscle. Now, the abdominal wall is made up of 4 layers of muscles. These are rectus abdominis, internal oblique, external oblique, and transverse abdominis. Rectus abdominis, which is this one that you see right here at the center, that's basically your midsection. In humans, that's what again forms a six-pack. On either side, the most superficial layer of muscle I have is the one that is peeled off right here. That's your external oblique. If I dissect through the external oblique, the layer underneath that is internal oblique. The layer underneath the internal oblique is a muscle that has horizontal patterns called the transverse abdominis. So here's another picture. Right here at the center, what you kind of see that white fascia on the center, that's your rectus abdominis. What's being peeled on the side, so you can see one right here and one right here, those are your external oblique. Underneath the external oblique, you will have the internal oblique. And then these deeper one that are you see right here would be the transverse abdominis muscles. Same picture might not be the best one, so we're going to skip that. You're welcome to review them on your own. Now, if you take a look at your cat, right at the center of your rectus abdominis, you see this line that runs in the middle as points of attachment. These lines is referred to as the linea alba. Now we're going to switch gears and move to the lower limbs. Now we're going to look at the muscles of the posterior aspect of the thigh first, starting with your gluteus muscle. So there's three muscles that are visible here. You have the gluteus medius, which is the first one, followed by gluteus maximus. It's a common misconception that the cats are going to have a large gluteus maximus like human. But again, do remember that cats don't sit on their butt, so they don't really need that quote-unquote support. And the third muscle you have is quadratus femoralis, which is found only in cats. Here's a different depiction. Again, you have gluteus medius, gluteus maximus, and quadratus femoralis. Now, in this case, your cat is in a prone position. A few muscles that you can see superficially is the tensor fascia lati, which will have a very pronounced fascia, as you can see the probe underneath. Right here is basically the fascia. And farther away, more inferior to that, is your biceps femoris, which covers majority of the posterior aspect of the thigh. If you look deep to that, one view of the vastus lateralis would be visualized here. However, do keep in mind, I would say 99% of the time, I don't label vastus lateralis on this view because it's easier to think about it as the anterior aspect of the thigh. I'm basically showing it as one of the four muscles of the quadriceps femoris. So, and again, here's a better picture of the tensor fascia lati muscles with the tendon very pronouncedly visualized. Now, if I turn my cat to the supine position, what you see right here is basically here is the your two lower limbs, legs. Here's the tail that runs in between. And here is the belly region, which basically identify your rectus abdominis and your external oblique. So kind of orient you guys if you don't know what you're looking at. It's hard to, again, visualize the positioning. So I'm looking at the medial aspect of the thigh, basically. So in this view, what you have is you have two superficial muscles. These superficial muscles are sartorius and gracilis. In humans, these muscles are relatively thin and parallel muscles. In cats, they are more broad. So you can again see the width of these two muscles are pretty big. So if I'm taking a look at it on this side, here is my sartorius again, which is identical to this. And this muscle on this side would be my gracilis. Now, what if I want to look at the muscles that are deep to sartorius? What can I find underneath the sartorius? So underneath the sartorius, you will find your quadricep muscle. So right here, what I've done is you basically dissected and reflected the sartorius. So right at the center of that deep muscles is your rectus femoris. Moving away from the body, you would have your vastus lateralis, which we also visualized on the previous picture. And on the medial aspect would be your vastus medialis. So rectus femoris, vastus lateralis, and vastus medialis. However, the fourth muscle is not visualized here. You actually need to move or cut through the vastus lateralis, rectus femoris to see your vastus intermedius. So underneath that, it says vastus intermedius, which is the fourth muscle, is found underneath your rectus femoris. So kind of showing you here. In this picture, they kind of move the rectus femoris to the side, so you can see one peeking from underneath. That would be your vastus intermedius. Here again, they are pulling the rectus femoris up to show you the vastus intermedius underneath it. But again, remember, those are your quadriceps muscles, the three vastus muscle, vastus lateralis, medialis, and intermedius, and then rectus femoris as the fourth muscle. Now, what do we have hidden underneath your gracilis? So in this picture, again, I want to kind of help you guys visualize this. Most superficial muscle right here covering this surface would have been sartorius. And the most superficial muscles that covering this side would have been gracilis. Now, we have talked about what's underneath the sartorius, which is basically your quadriceps muscles. So what is underneath the sartorius? Underneath the gracilis, I apologize. Underneath the gracilis, what we will have is, we have adductor longus, adductor magnus, adductor longus, adductor magnus, semimembranosus, and semitendinosus. So four muscles. Again, starting from the top, adductor longus, adductor magnus, semimembranosus, and semitendinosus. We already looked at the semitendinosus. You can also, again, visualize it on this view. And we already looked at the back of the thigh in terms of biceps femoris. Now, going farther down, you have your calf muscle, which is basically your gastrocnemius. You can depict it right here, and here is basically the Achilles heel. And then underneath your gastrocnemius, or deep to that, you will have your soleus muscle. Here is again depiction of all of these muscles. So if you're looking at the underneath the sartorius, see these blood vessels kind of separate the muscle from underneath the gracilis and sartorius. So this view right here, what I'm highlighting right here, this region is underneath the sartorius, and these muscles are underneath the gracilis. So underneath the sartorius, you have your quadricep muscle. Again, rectus femoris, vastus medialis, vastus lateralis, and then underneath the rectus femoris, you will have your vastus intermedius. Underneath your gracilis, which is this, you will have your adductor longus, adductor magnus, or adductor femoris. For cats, you have your semimembranosus and semitendinosus. Now, semitendinosus is kind of pointing up right here, so it's not very best visualized, but you guys get the idea. All the way at the corner, right here, above the adductor longus, you also have another muscle called pectineus. Pectineus is easily visualized in the human models, but it's a little bit harder to visualize on the cats. So it's all the way at the top, right here, that tiny corner muscle you see right here. Again, this picture kind of highlighting like literally the same thing we have discussed. It is a good view for you guys to get an understanding in terms of identification, so you'll be more comfortable when it comes to your exam. So again, here is they remove the sartorius. Then you will have right here, you will have your rectus femoris at the center, vastus medialis and vastus lateralis. Here, what you have again, here's your separation line. So this muscle is your pectineus, followed by, sorry, this is your pectineus, followed by adductor longus, adductor magnus, semimembranosus, and semitendinosus. And number 11 would be your gastrocnemius. Right here, you have, again, the superficial muscle depicted. So one would be your sartorius, two would be your gracilis. This big one that is basically your calf muscle is your gastrocnemius. And deep to that would be sartorius. I don't expect you guys to know number 7, so you can skip that. And then for the anterior aspect of the thigh, you will have the muscle that, sorry, not the thigh, sorry. The anterior aspect of the leg, you have the muscle that is covering partially your tibia, which referred to as the tibialis anterior. Now moving on, looking at some of the muscles that are found in the neck region, chin, well, I guess head and neck. We have underneath the chin, we have the two-headed muscle. That's your digastric muscle, and it creates that V shape right underneath the chin. Deep to that, right in the middle of it, you will have a muscle called mylohyoid. Going down in the neck region, which is what you see on either side right here and right here. This is the same muscle as a human called the sternocleidomastoid. However, because it doesn't have a point of attachment to the clavicle, which is right here, then it would only refer to as the sternomastoid. Again, kind of visualizing the sternomastoid, one right here and then one right here. Between those, medial to that, you have a muscle that starts from the sternum and ends at the hyoid right here. So these muscles are called the sternohyoid. So kind of visualizing again, you have your V-shaped muscle, your digastric. Coming in, you will have your mylohyoid. On the outer aspect of the neck, right here and right here, you will have your sternomastoid. Again, clavicle is not involved. And then in medial to that, you will have your sternohyoid. So that is it for the cat muscles. Let me know if you guys have any questions about it.